This medication, Fentanyl 600 Mcg Buccal Tablet, is used to help relieve sudden, breakthrough, cancer pain in people who are regularly taking moderate to large amounts of opioid pain medication. Fentanyl belongs to a class of drugs known as opioid analgesics, and it works in the brain to change how your body feels and responds to pain. It should not be used to relieve mild or short-term pain, such as due to headache/migraine, dental procedures, or surgery. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before using fentanyl, make sure to read the medication guide provided by your pharmacist. Use this medication as directed by your doctor. You should place the tablet in your mouth either above a rear molar tooth between your upper cheek and gum or under the tongue, and leave it in place until it is dissolved. Do not eat or drink anything while the tablet dissolves. If you start to have side effects before finishing a dose, your doctor may need to adjust your dose. The dosage is based on your medical condition and response to treatment. Wait at least 4 hours before using fentanyl buccal tablets again for another episode of breakthrough pain. Do not increase your dose, take the medication more often, or take it for a longer time than prescribed. Pain medications work best if they are used when the first signs of pain occur. You should continue to also take your long-acting opioid medication as directed by your doctor. Other pain relievers may also be prescribed. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. When this medication is used for a long time, it may not work as well. Though it helps many people, this medication may sometimes cause addiction. Tell your doctor if your pain does not get better or if it gets worse, or if you have more than 4 episodes of breakthrough pain daily, or if you need to use 2 doses of medication for each episode of pain. Some common side effects of fentanyl 600 Mcg Buccal Tablet include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or headache. You may also experience pain, sores, or irritation in the mouth where the medication has been applied. To prevent constipation, it is recommended to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist for advice on the right type for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Remember that the benefit of using this medication is greater than the risk of side effects. If you experience serious side effects such as interrupted breathing during sleep, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of adrenal gland issues, contact your doctor immediately. It's also important to seek medical help right away if you have very serious side effects such as fainting, seizures, slow/shallow breathing, severe drowsiness, or difficulty waking up. This medication may increase serotonin and rarely cause a condition called serotonin syndrome/toxicity. If you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. If you experience any side effects, you may report them to the FDA in the US or Health Canada in Canada. Fentanyl buccal tablets are used for managing severe pain in people who require round-the-clock pain relief and who are already taking other opioid pain medications. It is important to use the smallest effective dose for the shortest possible time to minimize the risk of abuse, addiction, and overdose. It is important to have naloxone available to treat opioid overdose and to educate family members about the signs of an opioid overdose and how to treat it. The risk of severe breathing problems is higher when starting this medication or after a dose increase. It is crucial to avoid using alcohol or other drugs that can cause drowsiness or breathing problems while taking fentanyl. Seek medical help immediately if you experience slow or shallow breathing, severe drowsiness, or difficulty waking up. Fentanyl buccal tablets should be used according to specific directions and should not be substituted for other forms of fentanyl, such as lozenges or patches. It is important to inform your doctor or pharmacist about all medications you are using, as some may affect how fentanyl works. To prevent theft, misuse, or abuse, it is important to keep this medication in a safe place. Women of childbearing age should discuss the risks and benefits of using fentanyl with their doctor, especially if they are pregnant or planning to become pregnant. Using fentanyl during pregnancy may slightly increase the risk of birth defects, and using it for a long time or in high doses near the expected delivery date may harm the unborn baby. Babies born to mothers who use fentanyl for a long time may develop severe withdrawal symptoms, so it is important to seek medical attention if any symptoms are noticed in the newborn baby. Before taking fentanyl, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have any brain, breathing, kidney, liver, mental/mood, or stomach/intestinal problems, difficulty urinating, gallbladder disease, or disease of the pancreas. Fentanyl may cause dizziness or drowsiness, and using alcohol or marijuana can make these side effects worse. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Avoiding alcoholic beverages is also recommended, and if you are using marijuana, it's important to talk to your doctor. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of fentanyl, especially confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, it's important to use this medication only when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using fentanyl, as it can pass into breast milk and may have undesirable effects on a nursing infant. When taking fentanyl 600 micrograms buccal tablets, remember that drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain pain medications, naltrexone, and samidorphan. Additionally, other medications can affect the removal of fentanyl from your body, which may affect how fentanyl works. Examples include azole antifungals, calcium channel blockers, HIV protease inhibitors, macrolide antibiotics, and ritonavir, among others. Taking MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. Avoid taking MAO inhibitors during treatment with this medication. The risk of serious side effects may be increased if this medication is used with other products that may also cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's important to check the labels on all your medicines and ask your pharmacist about using those products safely. Also, be aware that the risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin, such as certain street drugs and antidepressants. This medication may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or difficulty breathing, administer naloxone if it is accessible, and then immediately call 911. If the person is conscious and not showing any symptoms, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow breathing, slow heartbeat, and coma. This medication is specifically prescribed for your current condition and should not be shared with others. It should not be used for a different condition unless directed by your doctor. If a different medication is needed for another condition, your doctor will provide the necessary guidance. Fentanyl 600 micrograms buccal tablet is an effervescent opioid analgesic that is used for managing breakthrough pain in cancer patients who are already receiving and who are tolerant to around-the-clock opioid therapy for their underlying persistent cancer pain. It should only be used for patients who are considered opioid tolerant. The usual dose of fentanyl buccal tablets is 1 tablet of the strength prescribed by the healthcare provider. The tablets should be used at the same dose that provided adequate analgesia and adjusted as necessary. The fentanyl buccal tablet should be placed between the cheek and gum above a rear molar tooth. The tablet should be moved around the buccal mucosa in the mouth, using the handle of a plastic oral dosing applicator to moisten the tablet and to ensure adhesion. The fentanyl buccal tablet should be left in place until it dissolves completely, which usually takes 14 to 25 minutes. It's important to store fentanyl 600 Mcg Buccal Tablet at room temperature, away from light and moisture. Do not freeze it and avoid storing it in the bathroom. Keep all medications out of reach of children and pets. Make sure to properly dispose of this product when it is expired or no longer needed, by consulting the medication guide, pharmacist, or local waste disposal company. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.